Hi, Dr. Derschlag. This is my taping and wrapping video. And so for the first wrap that we will be doing, we're going to be doing the stirrups wrap. Now the stirrups wrap is a great wrap to use after someone sprains their ankle. A sprained ankle could result from landing on someone's foot, inverting it or everting it. This could be like when you're playing basketball and you land on someone's ankle and you twist it inwards, which would be inversion. Or if you're running on a trail and you land on a rock and evert it outside. Some symptoms for this would be pain, especially when weight bearing, some swelling and some bruising. Taping the ankle is a great way to help keep the ankle in place so there's less tension on the injured side and to help it from getting further injured. You would use a stirrups wrap because it allows for dorsal and plantar flexion, but helps keep the ankle from everting and inverting. So it'd be great for using in sports to keep you going. So for the stirrups wrap, what you're gonna do is you're gonna start off with some pre-wrap, just because you don't want the wrap to be pulling hair off of the person and it makes it more comfortable. So you're gonna start by wrapping it around the top of the leg and then going down the ankle. Just that. Off. Then you're going to get your wrap. You're going to start by putting a piece of it at the top of the leg here as the anchor point. You just have to go around once because it's just an anchor. You're going to rip it, get it in there. Next thing you're going to do is you're going to put the foot in dorsiflexion, because you want the wrap to be tight right here on the medial and lateral sides. You're then going to start by attaching a piece of tape to the anchor, going down and to the heel, wrapping it around the heel, going back up, and then you want to keep the foot in dorsiflexion, put a little pressure on there. So you can get it nice and tight before putting it on and smooth it all down. Then you're going to do that again, but this time slightly more posteriorly. Again, keeping the ankle dorsiflexion, putting tension on it. And then you're going to do one more, this time more in the front. Again, keeping tension. Taping it to the anchor and then patting it all down. And then for the final step, you're going to grab another piece of tape and put it back on just to support it all and keep it all in place. And that right there is an example of stirrups wrap. So the foot can still move plantar and dorsal, but it can't evert or invert as much. And then for my next wrap, I will be doing a figure 8 wrap for the knee. So you would use a figure 8 wrap for someone who might like sprain their knee, which would result from them twisting it and or bending it beyond their normal range of motion. So an example of this would be somebody skiing, and when they fall, they accidentally twist it, or from a sudden change of direction and twisting their knee. Symptoms of a knee sprain would be swelling, pain, tenderness, and bruising. And then the figure 8 wrap will help limit the knee, or help support the knee, help limit it from swelling, and it will allow for some range of motion, but overall just keep the knee in place. So to do this, you're gonna get like an ace bandage. You're gonna start by wrapping over the top of the knee, and then you're gonna go down and wrap underneath the knee. And then you're gonna go back up and go top the knee, and then down, and then finish it off with the clips. Just like that. So that's a great way to keep some range of motion. There's definitely less range of motion. That also helps keep the swelling down and stabilizes the knee.